which at least keeps me updated with what's happening with some of the people, which is great.
After the COVID, the best part which has happened is our reconnecting with all friends on WhatsApp. As long as we don't make it an addiction and don't overdo it, it's a wonderful way of keeping in touch.
Yeah, that's definite. So, Gurudat, do you see a lot of ADHD?
Yeah, increasing. What I used to see in 1 year in my first 5 years of practice, I'm seeing in 1 month almost.
My God,
Yeah.
It's just exploding, madam, in private sector.
Sad.
I think that's why I thought I just wanted to do today. I'm just going to do understanding ADHD, and rather than
Okay.
going into the theoretical aspects, and then we've got Dr. Upasana Kapoor who's going to do it. I think in a week or two. I don't know, Dr. Samisha, which day is Upasana going to do it? 2 weeks.
Next November. November.
Next month. Yeah.
Next month. Yeah.
So that will be on the management of ADHD. And I would prefer an interactive session, but I don't know how interactive sessions go. So maybe on chat or whatever.
No, we have time, Anaga. We'll have an interactive session.
I think so, because that actually adds value.
Yeah.
Isn't it? I've been seeing it for a long time here. I've talked, I think, in 2017 in the IAP in Mumbai. Swati, I can't remember when.
Correct.
Pedicon.
Yeah, I think that was 2000. Let me remember,
2017.
70. Okay.
So that's almost 7 years back.
Yeah.
Yeah, it's increasing everywhere.
Mm.
Are you all seeing adults with ADHD now?
We are seeing a lot of adolescents.
Students.
Adults, I don't see.
Anaga, getting a lot of college students who are self-diagnosing ADHD and coming to me for counseling.
Yeah,
So
yeah.
I'm getting a number of
because
them.
over here, what is happening, a lot of the adults are now, when they come for pediatric patients, they realize they have the same symptoms as childhood, and they're going to the psychiatrist, getting diagnosed and getting treatment. So that's a new trend over the last year or two, which is interesting.
We should blame the movies. Many of the movies are now showing adults with ADHD. So that's probably another reason why you have.
Gurudat, which movie?
I'm trying to recall. I'm just trying to recall. I'll put it in the chat. I'm trying to recall 1 or 2 movies where it's become very famous.
I didn't know that. Huh?
Yeah, because actually I think my son or daughter told me. I didn't actually see it.
Actually,
so I
this
can't recall the name.
Monk detective stories expresses OCD very well.
Yeah.
And gender dysphoria, there were 3-4 movies recently in India. So
yeah. I think when I first talked about gender dysphoria, that must have been 8 years back, Swati?
Yeah, 2019, our ITPA.
5 years back, yeah. It
And
was
I'm
such
just forwarding to you the gender dysphoria which I gave at Nasik, which Swati got because I could not go. I just shared. Yeah.
That was, I think,
Yeah, 2019. That was the first time many people heard about gender dysphoria. Your lecture is very good.
Yeah. That is still a controversial thing yet.
Yeah. Samir, shall we start?
Madam, it's Percy Jackson series, wildly successful among adolescents, which is showing ADHD. I just can't remember it because I have not seen it.
Whenever you remember, Gurudat, I'll put my phone number in the chat.
Yes, please. I'll send it across.
Yeah,
I'll send it across.
Thanks.
Yeah, I think Dr. Samir, you will have to monitor the chat because I can't see it.
I'll do it in between.
Rohan has done this as full screen as per your advice, so it's all good.
Just wait, I'm making a live just 2 minutes more, and then we can definitely start.
Whenever you say you're starting, we'll stop talking.
Sure.
Gurdat, I put my email as well as my phone number.
Yes, ma'am, got it.
Welcome, Farzana. Farzana is a clinical psychologist from Jahangir Hospital. Farzana, are you there? She's a neuropsychologist.
Nice.
Hi, Farzana.
Hi, Dr. Swati. This is a different Farzana.
Yeah. Just put your video. I'd like to introduce you. You can tell us a little about your work.
I'm a different Farzana. I am
No,
not
you're a different Farzana. Okay.
yet. Okay.
What are you doing, Farzana?
I'm a general pediatrician with
Okay. Which part?
Manipal Hospital, Kharadi.
Okay. Nice knowing you.
Yes, madam. We can start now. So very good evening, and welcome to the one more episode of the our international forum webinar during this auspicious day of the Dasera. Wishing you all on behalf of the Aacci happy Dasera, and we will definitely do the good over the evil that about the different diseases, and that's one of the very important topic about the ADH. Before I hand over the mic to our eminent speaker, I requesting our Executive Director, Dr. Swati Pave Madam, to give the welcome now.
Thank you, Samir. Welcome, Anaga, for our International Forum episode. Our Anaga doc is the coordinator of our International Forum from Hobart, Australia. She was the professor of pediatrics and neonatology at Nair Hospital, and many of you must be knowing her. And she's a very, very close friend of mine. And she was a very well-known speaker in our ITPA, International Advanced Course on Adults in Medicine, which she did in 2009, where she spoke on another important subject of gender dysphoria. ADHD, as we all know, is becoming an important issue for all of us to deal with, not only pediatrics, including adults. So today we have requested Ananga to join and give us an understanding of ADHD. And in the next episode, her colleague Upasana Kapoor will be giving the management of ADHD. As usual, we'll have a good interaction at the end of the program. So while the talk is on, you're free to keep your questions into the chat box. At the end of the session, Samir will coordinate the question answer session. Thank you, Samir. Thank you, Anaga. You can start, Samir.
Right. So before I hand over the mic, it's my privilege to introduce Dr. Jaikar ma'am. I am not sharing my screen because madam has already said, and we don't want to change that setting at present. She is the community pediatrician and head of Tasmanian Community Pediatric Service at Australia, having a very special interest in the child protection, neurodevelopment, trauma, and disorder. And that's why she is just going continuously with such a unique topic. Gender dysphoria. This now we are definitely today we talk about the understanding of the ADHD. We all know when the patients, pediatric patients, just here enter in the our cabin as during the OPD. Many times we feel the all the patients are look like a ADHD because they are jumping here and there, and it is really a difficult task for us to interpret because it will be definitely difficult for the recent parenting that lead to the more problematic rather than the child, and they are giving all the demands and completion of the children's requirement in such a way that child is demanding more and more, and that will be increasing that chances of that ADHD in that child. So definitely, what's the importance of that ADHD? Whether we can take told that thing is a ADHD or there is any specific concern related with ADHD, how we specifically define an ADHD. We had kept this today's talk on the understanding of the ADHD. It means the really interesting talk, and then we are having a next part about the management of that. So let's without wasting much time, I hand over the mic to our today's eminent speaker, Dr. Anga ma'am.
Good afternoon, everybody, and thank you for inviting me to this webinar, Swati and Dr. Samir Shah. Happy Dasra to all of y'all, and let's begin. So before I talk about ADHD, I'd just like to show you where Tasmania is. It's the island at the bottom of Australia, and Hobart is the city in which I live. And so let's get so after the geography lesson, let's go on to the topic. So, for the learning objectives for this talk, I just thought let us understand the prevalence, the symptoms, the differential diagnosis, and the impact. What are the superpowers that ADHD children can have? What are the struggles they face? And what are the strategies we can use to manage them? Okay, so ADHD or attention deficit hyperactivity disorder is really a persistent neurodevelopmental disorder. It is developmentally inappropriate degrees of inattention and or hyperactivity and impulsivity in children, and it is a lifelong condition. So it is one of the most common behavioral disorders of childhood, and as it is an increasing prevalence. The only literature Indian studies I could actually find was uh, a narrative review in 2017 where they had done 73 studies. uh, they had screened 207 and excluded 134, and the prevalence, as can be seen, is varying from almost 5% to 30%. There were a lot of methodological limitations in the study. There were small sample sizes and a lot of it was some were school based, some were hospital based, and there were lots of varying themes in that. But the purpose of this sharing this article was really looking at the prevalence and how wide it can be. The prevalence increases if the child has had maybe preterm infants, preterm prematurity, whether they have associated other neurodevelopmental disorders like autism, learning disorders, intellectual disability, if they have other behavioral problems like conduct disorder or oppositional defiant disorder, sometimes increased prevalence with mood disorders, and also with adverse social circumstances. Family history, if it's positive, there is quite a high chance that the family members can have ADHD. Acquired brain injury and epilepsy are other conditions where you can have increased prevalence. But the important thing is it was under recognized in girls for a long time because girls used to have quite often the inattentive type, and the boys were picked up as the hyperactive, impulsive uh, uh, type, and therefore it was not recognized as often. It is diagnosed by symptoms and looking at the diagnostic criteria in the DSM 5 Diagnostic Statistical Manual. And really, the main thing is that if the symptoms persist uh, and interfere with function or development, if the symptoms last for more than 6 months, and several symptoms present prior to the age of 12 years. So even if your teenagers are coming with wanting a diagnosis, the symptoms have actually to begin much earlier. And they have to present in two or more settings. Children, there should be at least six or more symptoms, and in teenagers there should be at least five or more symptoms. And these symptoms should not be explained by any other mental health disorder. So you have a whole list of symptoms. I'm not going to go through them, but you're basically being distracted, being disorganized, being forgetful, losing things, finding it, fidgety, squirming, interrupting others, often on the go, talking excessively, blurting out answers. So there are a whole lot of symptoms which you can read, but it's really inattention and hyperactivity and impulsivity. And so when you have these symptoms, you can have a combined presentation, or you can have a predominantly hyperactive or inattentive presentation. So which symptoms do you think are easier to spot? Yeah, you want to put it in the chat?
Of course, madam, hyperactive.
Yeah, of course, hyperactive. Absolutely. And then what else could cause these symptoms? Does anybody want to start? Tell me. Or if you put it in the chat and
Like you can have a sugar high. Many
yeah,
children, after
yep,
having excess sugars, are very, very
yep.
hyperactive and restless.
This hypoglycemia, yeah. Anything else?
A very highly gifted child may appear restless and bored. if his
Yeah,
attention
they could
span
appear
is
restless and
very,
bored. Yes,
yeah.
Now excessive use of yeah, screen time also.
excessive use of screen time. Yes. So there are lots of them. If there's hearing or vision impairment, they may be restless in class. If they are sleep deprived, sleep is a big uh, thing. If the child is sleep deprived, they can be, if they can be having some neurodevelopmental trauma, family violence in the home, their vigilance, they could be restless. If they've not eaten, if they've not had their breakfast, or as you said, hypoglycemia, if they've got some other infection which has not been identified, sometimes iron deficiency anemia can present with behavior problems that could look like ADHD. Specific learning disorders where the child is dyslexic and can't read, or has a vision impairment and is acting out in class, they may mimic that. Environment, if it's very hot, if it's very cold, if the friendship changes, the school changes, the house changes, there's history of trauma, abuse, sometimes in teenagers, substance use, withdrawal, all of these can cause ADHD. Not, I won't say cause ADHD, but will look like ADHD, but it's not ADHD. And therefore we have to be careful and rule out other symptoms, because even in trauma, which is your adverse childhood experiences, there's a lot of overlap between trauma and ADHD, because the child could be easily distracted, not seem to listen, be hyperactive, restless, cannot sleep. And it could be because of stuff that's happening in their house, which has not been really identified outside. So it's a good history is absolutely important before jumping to just the symptoms. And the thing is, we have to also think, what is it like for the child? Yeah, because for the child, whatever the cause, the mind is like, going in all directions, and not cannot think, cannot act, and so it's really confusing for these children. And then they can start feeling that they are lazy, they feel worthless, they feel bad, they feel they're dumb. So there's a loss of self-esteem, unless we know what the problem is. And that's the important thing to remember. The reason for diagnosis is so that we can explain to the child that it's not really his fault, it's just a neurodevelopmental problem. Okay. But if you want to take a strengths based approach, you have to look at what are the strengths that children have with ADHD, or we can call them the superpowers. Can you all think of any?
They're excellent in video games. Their coordination is very good.
Okay, yes.
And that's why they get more and more addicted to video games. Because
Yeah.
that is
So
what
that is
basically
hyper
causes.
focus.
Yeah.
Hyper focus in what they can. Yeah. What else?
In sports also.
Sports, yes. Athleticism, very good. So they can have leadership qualities, they can have a humor, they can have hyper focus, as you said. If they're interested in video game, they can excel in it. Some of them are very creative because they can think of ideas way beyond what the normal people would. They can be very innovative, they can be quite enthusiastic, and athleticism, as we said. So we have to not just think of ADHD as something which is bad for children. There are things that we can give them, you know uh, find out what their strengths are and help them to develop them. Okay. Now I don't know how many of you all know Dan Siegel's hand model of brain.
I think
Are you all
actually,
aware of it? If not, I'll just demonstrate it. I didn't draw the picture, but what it is, if you take your hand, all of you can take your hand, put your thumb across the palm, and make a fist. Okay. So I'm just asking you all to do it, although I can't see it, so that you all remember it. So if you call this the spine, can you all see my hand?
yeah,
Okay, if you call this the spine, the fingers on top is the cortex. Okay, and the front part of it is the prefrontal cortex. When you open, if you open this could be considered the brain stem, and this is the limbic system. So the limbic system has the hippocampus and amygdala, and your brainstem has, so we have the upper part, which is your cerebral cortex, which has the logical thinking brain, socializing reasoning brain, and when the inside of it is the co- you know uh, sort of subcortical part, where your midbrain is here. Now, midbrain limbic regions are basically, this is a very simplistic understanding, but this is feelings and emotions. And the hindbrain is your basic functions and reactions. So that's your flight, fight, freeze, etc. So normally this whole brain works in harmony, and the cortex and the thinking brain sort of hugs the rest of the uh, brain and keep allows it to feel safe. Okay, but when the upper parts and the lower parts of the brain are no longer connected and talking to each other, you have what is called as flipping the lid. So when the child flips the lid or gets, into their temper tantrum sort of mode or thing, what happens is the connection between the emotions and the thinking does not happen. So trying to reason with this child when they flip the lid is really not going to be helpful. And sometimes it's really, this is a very good way to explain to parents how the brain of this child is functioning and why they're behaving in this way. So they first need to feel safe and calm, and then only can you actually have the logical reasoning part of it. And they have to understand the emotions to be able to feel safe and calm. Would that make sense?
Very nice, very well explained.
Okay. So, really, what we're looking at in this whole thing is, what is this prefrontal cortex? What's the role?
What
Okay.
is
So, it's really executive function. And these executive functioning skills refer to the range of cognitive abilities that help us to regulate our behavior and achieve our goals. And these skills are actually important for everyday tasks for all of us. But we have to remember that the executive function, again, the prefrontal cortex develops over time. It's not an immediate thing. So between the ages of 5 to 10, the children start to learn to pay attention, control behavior, and follow simple sets of directions. They start using their working memory, recall information, and applying it to current situation. We have to allow for that brain to develop. It's only in the teenage years or from 11 to 14 that they will learn to think and plan ahead. They learn to problem solve. They learn to follow daily routines and develop self reflection skills. And it's from 14 to 18 that they learn to think and behave with flexibility. And then they can, at this stage, actually collaborate with peers to complete projects. And then they can, at this stage, adapt to shifting expectations and rules. So we have to look at the executive functions as they occur as per the age of the child, and not expect too much from the younger children. Okay, so a little more this diagram, I don't know how much you can see on the slides, but I've written out some of it. And this is looking at executive function and ADHD. Okay, so basically, what happens for impulse control? The child will pause. Impulse control allows us to pause before speaking or acting, and so if it's lacking, then they are very, they'll blurt out thing. Self monitoring is, ADHD kids might be viewed as making careless mistakes. You know, they might find it difficult to manage their emotions. As a part of executive function is emotional control. Flexibility is adapting to change. So they can appear to be quite rigid, and will not find it difficult to look at problems from another person's perspective. It'll be their view because they can't see what the other person is thinking. Task initiation is starting school work. They might know the stuff, but the starting part is difficult. They might need a little extra support to get started. Organization is like keeping bedroom clean, tidying, knowing where the things belong. Working memory is holding information and using it, and like following verbal directions, solving maths in your brain, all of those things. Planning and prioritizing is attending to appointments on time, saving money for a goal. So these are the sort of main eight there could be more, but these are the ones which are quite often affected in ADHD. So you can understand that you have the age which allows the maturity, and even if it's mature, ADHD can have a little difficulty because of the delayed sort of maturity for executive function. Okay, so I'll just give some examples. So, what executive function would this child? Rohit often interrupts midway through a conversation. He frequently cuts others off and speaks over the top of them. So, what executive function and what can you do to support?
One part will be impulse control.
Yeah. And what can we do to support? So, impulse control and working memory. He may not remember the steps here. So, you have to teach him how to take turns. Well, you can do, like, depends on the age. You can ask, play turn by turn taking games, play turn taking games, your turn, my turn, so that they learn to uh, wait. Praise and name the behavior that you want to see. Okay. That was amazing when you waited your turn. So you have to be specific in praising the action rather than saying good job or something, right? And you can often provide some clues rather than singling them out if they've done something, you know uh, to just help them to develop some mindfulness skills, and sometimes if they want to talk before, you can give them a paper and pen and tell them to write the ideas and talk about them when he it's his turn. Okay. Second example, Sachin was playing Uno with Ajay. Ajay's rules were different, and Sachin began to get angry, stating, "You don't know how to play the game." This is a common thing when children are playing their games. So, what executive function would this behavior fit?
Flexibility,
Sorry?
flexibility, adoption.
Like flexibility, yeah. So it's basically flexibility and emotional control, yeah. So then you have to use again mindfulness activities or playing games that encourage multiple ways of problem solving, sometimes mapping directions, you know uh, doing some maths activities, etc. So, and also identifying emotions, yeah. Those things are important. Let's see. So now, what Kalyani is often late and forgets her appointments. What would this be?
Of organization, time management.
Beautiful. Yeah, so planning, time management, organization. Yeah, so these are using reminders, setting alarms, writing appointments down as soon as they uh, need to happen, etc. What is this? Bola seems to get angry over the smallest things. Yesterday on the way home, his dad needed to stop at the shop. Bola screamed that he did not want to stop. What is this? I think these are sort of things which parents can come and tell you all as complaints in your clinics.
We'll have a number of things like impulse control, emotional control,
Yeah,
flexibility, not able to
yeah,
adopt. A large
yeah.
number of 4, 5 things together.
Exactly. So what I'm trying to say is it could fit anything, emotional control, emotional literacy. He does not have the vocabulary, flexibility, and you can have many things. So a lot of the time you can do some mindfulness strategies like where does the body feel worry? What does it feel like? So you can do some mental body scans. You can also name the observation and feeling. I understand that this is wasn't what I planned. I can see it's making you upset. Just help them with some emotional literacy and getting some flexibility stuff in. I asked Mira in the morning to grab her drink bottle, pack her lunchbox, and brush her teeth. But often she can remember one or two out of the three. What can we do to support, and what is this?
Again, like time management, recall, and memory.
Yeah. So this is really working memory. Yeah. So for children who are still young, their working memory is still not developed, you can actually provide just limited number of instructions at a time, and check whether they've understood what you have said, and then remind them, and then don't get upset if they've forgotten. It's uh, it's not that they want to forget, it's just that they're still developing that skill. All right. So when you want to look at flexibility as what strategies you can have, what are called as wait cards, traffic lights, when they're waiting, and think about telling them what they can do while they wait, in a clinic or anywhere where they have to wait. You can have the countdown timers. You can have them on your phones now, or you used to have that sand uh, thing where you turn it around. You can have visual scales to, see how they're feeling while they're waiting, and that'll help them. You can have things like power cards. That Dora is something which is popular here. You can use something there. And Dora wants me to remember these three things. If you want to tell them something. Keep my hands down, use my words with a quiet voice, keep working hard, whatever you want to help the children to remember. And then there's a technique called a SOAR technique, which is look at what is the scenario or what is the specific situation, observe what happens, analyze what happens, respond, and see what, and then reflect whether the response was appropriate. So there are different strategies that could be worked on to help children with flexibility. So, if you're looking at strategies in the classroom, what can we do? Review the basic needs of the child: food, environment, safety check, make sure that there's a universal design for learning, use visual timetables and timers, write clear written instructions as well as verbal, because sometimes they may not be able to read, they may have learning disabilities, etc. So, you can have a multimodal instruction. And again, break down the tasks into steps so that if children have a problem with trying to remember too many things, working memory, they can do one task at a time and be praised for that. And habit stacking, that means if they can get this, then add another extra activity, then another extra activity. So these are things which children teachers can use in the classroom, irrespective of whether the child is diagnosed with ADHD or not, because all of these things will help improve executive function for all the children. Okay, and then sometimes they may need to get breaks for body and brain. They may need quiet spaces, and then they need to be helped with their emotional regulation. And ease the transitions with giving a job. That means if you're going to change from one thing to the other, give them a task to do so that they know that this task is over, then this is the break time, and then the next task starts. So these are some of the strategies that can be used in classrooms. And for brain breaks, you can do something like a coloring in, or you can do rectangular breathing, that breathe in, stop, breathe out, stop. And other things could be activity like heavy activities, push-ups, carrying a heavy load, chin-ups, pushing, pulling, using crunchy snacks, some dancing, spinning, walking on tiptoes, balance beam. So there are lots of things that you want to get them active for 2 minutes, and then they can sit back and do another thing. It allows them to have a brain break. So some general ideas for parents to support their children. Really, the most important thing is try to help the child to manage their symptoms rather than aim to manage the child. Very, very important. And parents should build their understanding of ADHD and the emotions and behaviors that can be associated, because the more one understands, the more one can support the child to build their capacity. And every child or an adult experiences ADHD in a different way. So what works for one person may not work for the other. And it's, although we don't call it a spectrum, the severity is on a spectrum. So you can have mild ADHD or moderate, though we don't have a sort of scale to call it mild, moderate, severe. But the symptoms can be mild, moderate, severe. And the most important thing is, because their self esteem can go quite low, it's remember to comment and praise on the positive effort they make, even if when they are not completely successful to your expectations. Because one needs to reflect on, the parent needs to reflect on their own capacity for patience and understanding. And if they manage their own self care, they'll be able to be more patient. Okay. So you can put on, like parents can put on a detective hat and choose a couple of key difficulties to work on with the young person, and then start small, as I said, and work the way up. Like, check with the working memory, how many instructions can they manage, and then add another one, then look at other things in the same way. Is These are the things we can help parents with. Okay. And simple things like ensure that the child understands what is expected, because we may say something, they may understand something else. And sometimes important to speak slowly and softly rather than loudly or shouting, because then they can turn away from the sensory overload. And the one way to make sure that they have understood what you said is ask them to repeat it. Okay. And most important thing is turn off the TV and computer games during meals and homework, so that they can have a proper attention to and focus on the task. And one has to provide the structure to the home life and bedtime. to allow the child to have that clear boundary and expectation. Write down a schedule, maybe stick to the schedule, write it on the fridge, whatever works for an individual child. And if there's a long assignment, plan some breaks. Give Sometimes you might have to give rewards, and they could be verbal rewards. It doesn't have to be things, for paying attention and just sitting, because that's an achievement for a child who can't sit still. And try to identify and eliminate triggers. So a noisy background, somebody else doing something, or planning to go somewhere and they have to do something in a hurry. So try and identify and eliminate triggers. Okay. So what parents actually need to remember is children with ADHD are inattentive and impulsive and sometimes overactive, but not all children with these symptoms have ADHD. Okay, there is no single test that can currently diagnose ADHD. The assessment is usually by a doctor or a psychologist, and it really involves gathering information from the family, school, and a clinical assessment. Positive parenting strategies, supports in schools, and sometimes counseling supports for parents as well as children, or what is called as ADHD coaching, can support most children. And quite often, these children have other challenges that need to be addressed, like learning difficulties, anxiety, sleep problems, and these challenges have to be addressed for ADHD symptoms to improve. In the classroom, teachers again have to keep distractions to a minimum and provide specific logical places to keep, whatever they brought, schoolwork, etc. Setting small, reachable goals and giving token economy of rewarding positive behavior. Identifying unintentional reinforcement of negative behaviors, because sometimes negative attention is what these children get and they continue to be given that attention, and that reinforces the behavior. And using checklists, limiting choices, finding activities in which they can be successful, and using calm discipline, removing the child from situation, timeout, etc., can be used. Distraction. What is our role in this whole uh, life span of a child with ADHD? Basically synthesizing and interpreting information about a child's behavior, identifying the other medical problems and other psychosocial problems, refer for further evaluation when needed, like a psychologist to do a learning behavior test, etc., arranging for supports, providing appropriate medical treatment, monitoring progress, supporting parents in their role as advocates for the child, and discuss when medicine should be stopped or transition to adult care. And I'm not talking about medicine, but those are things for further discussions. And then my key message on understanding ADHD is really that it's a very common problem, as you all are all experiencing now. It's very easy to diagnose and treat. What we need is parental understanding and educational support, ongoing follow up to see if anything changes, and we really don't have long term outcome studies to see what happens to the children where you've treated them, what happens to them when you've not treated them, when do we need to stop, and what happens to their education, etc. There are no long term studies anywhere. Uh, both, I mean, they're just in place, but no results yet. And I think India, it's time somebody actually took on the task of understanding what their cohort says. And thank you. I hope that was useful.
So, Anagha, it was a wonderful lecture, and I'm sure there'll be a lot of questions. So, I request everybody to start putting the questions in the chat, or you can raise your hand and if you want to ask a oral question. I'll just start the ball rolling. Anagha, I wanted to know, like in your
Yeah,
experience, how
yeah,
many children who have
yeah.
ADHD diagnosed in early childhood can grasp the disease when they are teenagers and can help in self management? How many of them get that insight, and how many of them can cope up with that versus those adolescents who are diagnosed in adolescence and the diagnosis missed in childhood?
Very good question. Thank you for that. So, look, not every child is diagnosed in early years. And that is because, again, it's a severity. If there's a demand and capacity, if the child is, scaffolded and supported to manage stuff, they may not need medication. Sometimes children, about one third of the children who you start on medications, don't need medications beyond, say, primary school. Some one third would need it into teenagers, and one third would need it lifelong. 10% may not need medication. So the thing we need to remember is, whenever they're diagnosed, we have to explain and give them strategies to manage the executive function, and that's what will help them. And I think it's easier probably to explain to the parents as a child so that they manage it, but for a teenager we have the opportunity to explain to the young person themselves, and they take it on board when they're interested in knowing how to improve themselves. Sorry, I can we
Is
get
that-
any
Yeah,
behavior
there's
management
another
training
question.
video?
Yeah,
Yeah,
you can read the chat. Can we
I
get
just read
any?
that thing coming up.
Yeah,
Uh,
any
so
exercises to improve attention focus for kids?
these are the principles which I've talked to you. So it is really important uh, to understand that no child's behavior is without a reason. Okay, the disciplinary into yeah. So I'm reading that, but let me tell you. So any behavior that the child is demonstrating is a way of communicating or a way of connecting. So all behavior is communication and connection, not something which is purposely done by a child to annoy the parent. you know and so that has to be understood by the adults in that child's life, and they have not to be behaving like children. So that's why I talked about executive function, and understanding that it is really important to help the child regulate, stay calm, and give them strategies so they can learn to manage their behaviors as they grow older. Discipline um, without understanding doesn't work, because I don't know how many of you all have had a stern discipline as a child. You remember the discipline, but you don't pick up the lesson that you want. So explanation and this thing. A second thing is, it can't be done when the child is flip the lid. Okay, so at that point there's no point. You have to identify the triggers, allow them to settle down, and then look at explaining at the in the way that is acceptable. And most behavior has to be modeled by parents, and you have to do what you want them to do, rather than say do this and do something different. So very often we are on screens, we are on not talking at and we have to be honest and understand how children model our behaviors. So that's very hard to tell as a pediatrician to parents, believe me. When you have the child the mother screaming and telling the child don't scream, you know, uh, it's really, really difficult. Even things like sleep, unless there's a sleep routine put in, if children are up and about watching a movie at 11 o'clock at night, how are they going to go to school and learn next day? So there's so many things. You don't need, they're all common sense strategies which we all know. Sometimes it's hard to explain to parents. um, and I don't know this. I'd like to hear your experiences about uh, what you'll have. Yep.
I think another
Melatonin.
what you're saying is the parental management. There are many parents who somehow firmly believe the child is a bad behavior child and is doing everything to annoy them. And it
That's what
takes
I
a
said.
lot of counseling to make them understand that the
Yeah.
child has a problem and he's not troubling you. He's not a troublesome child.
Yeah. So that's
Once the
really
parents
so.
understand, I think the responses are much better.
Yeah. So that's why, I'm telling you, explaining it, I found it really useful to use the hand model to explain what happens to the child, and flipping the lid, and just the simple thing of saying this is the thinking brain, this is the emotional brain. They have big feelings, they don't know how to manage them. There's a very nice video. Somebody asked about a video. There's a very nice video called collaborative problem solving. I think. If I can't remember um, name, but it's a psychologist from Harvard. The name will come back to me. It's called collaborative problem solving, and I might send it across to Dr. Samir Shah when I find it, and then you can share it on a resource in this thing if you like. Uh,
Sure.
the name eludes me, but if you wanted, that's a video which shows that you need to be part of the solution, and you want to say that no child's behavior is bad behavior. It's only a way that they're communicating because they have not learned the skills, and as adults in their life, it is our responsibility to help them learn those skills. I saw a question on melatonin. Yes, ADHD as a neurodevelopmental disorder, uh, you can have sleep disturbances. You have to put sleep hygiene and sleep routine into place. And if that is not enough, then melatonin helps. Okay, melatonin helps in a very small dose. It works well for about 3 months, and then you need a break if you need to give it. But in ADHD or neurodevelopmental disorders, melatonin does help.
There's another question, Anaga, from Dr. Jayashree Deshpande. A severe
Hmm.
ADHD child needs multidisciplinary intervention lifelong. That is the question. And after how many months we should call them for follow?
Very good question. So basically, a severe ADHD, you need to give parent education and what we call as ADHD coaching. So it could be anybody, OT and an occupational therapist can help them with some self-regulation skills. They don't need this lifelong. Parents just need psychoeducation and strategies, and they need to change their behaviors to help the child. Okay, medication helps, uh, and the medication, if you give, sometimes, as I said, 30% will need it lifelong. So I would stop the medication. I will stop the medication in December, Jan, when there's no school. So I would give medication mainly for children if they're not learning well in school. And under 5 years, we just do behavior strategies. Or more than that, I would try medication. I'll give a trial, and if it works, then I will give it regularly, and then I will monitor the child every 6 months for height, weight, blood pressure. Once I have given increase the dose per the trial, but I'm sure Upasana will talk about all of that. And then I would give them a month or 2 months off in the December, January holidays so that they learn to manage without medications. The severe ones cannot manage without medication. So it depends on how parental patience and what activities they're doing. And then sometimes teenagers take themselves off medication in when they, and if they can manage, that's fine. Sometimes if they're untreated, ADHD can higher chance of using substances as a means of self-medicating. So it's a question of individual decisions and checking how each child does, or and parent support and educational support. Yeah.
Dr. Gurudat has put the name of collaborative problem solving, Dr.
Yeah.
Ross Green of Harvard.
Dr. Ross Green, and there's another one. Yeah. Yeah.
Okay,
But,
Samir,
but
you can take over the other questions.
Yeah, yeah. One question directly came into the mind. Just you just described the management part as a severity. So, is there any specific scale that what you are using for the severity
yeah.
diagnosis?
Yeah. So basically the diagnosis, and again, because that's going to be talked next time, but the basically what we use is the DSM-5 tick 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 for the same. Then you send out corners. So you can use two types of scales. You have a Vanderbilt scale, which is available online and it's free. We use the corners 4 now, where we send out online the scales to parents and to the teachers. You want the scales to show how the severity on that. So they're called T scores. And if the T scores are higher than, say, 70, sometimes the parent will write 90, 98, whatever, and the teacher will write 40, 50. So if they're different, yeah, in the school and the home setting, then you know the problem is there's chaos in the household, and the child needs some more behavior managed strategies there. But if they're both at the same sort of area of severity, then you would treat the child in both settings. In a teenager, I would also give a self report, because then they will understand where they are on the scale. And those are the T scores, and anything around above 70 across hyperactivity, uh, in attention together, like sometimes it's 80, etc. I'm happy to try a medication, and especially if it affects the learning or the executive function. So the corners and all will show you whether executive function is affected. So if those things are affected and the symptoms are high, it is definitely worth giving a trial of medication and monitoring the child. So monitoring wise, really, weight is the main one to monitor, because there's quite a significant decrease in appetite. So you would normally give medication after a meal. And blood pressure is another thing we monitor. So it's not, yeah.
No, one more question is regarding the therapy part also. So we will definitely take that question in the next episode also. Can the pet therapy, music therapy, such type of the therapy, that making the more socialization of the children is effective way of management? That was the question, but it will be again coming into the management part only.
Yeah,
So
but
it's
basically, what the thing is, what you want is the child to self-regulate. Yeah, so if the child needs self-regulation because of the thing, it is understanding the emotions, helping them manage the emotions, calming techniques, breathing techniques, music, any repetitive activity will help self-regulation. And so if it's music, it could be drums, it could be, activity wise, it could be boxing, it could be running, it could be swimming, it could be laps, it could be basketball, it could be hoops. So a lot of repetitive patterned activities will help the children with self regulation. Yeah, so irrespective, but the music depends on, if they enjoy the music, then that's good. Yeah, if they enjoy, but it is completely individual. If they like swimming, swimming as an activity is great. If they like athletics, it should be something the child enjoys, it is fun, rather than a therapy. Does that make sense?
means it's become a more of the mindfulness rather than the compulsion. That's a really good thing.
Yes,
What
yes.
you want to say? It's absolutely perfect, ma'am. One more thing, the question parallel with that, any food that aggravate that behavioral problem in such children.
Well, it's not quite documented, but sometimes added food additives can be, it again depends on an individual child. Like I had done a talk on ADHD, and we had the parents there. And one parent who had ADHD as a child told me, I could have anything orange, but if I had something green, I used to get symptoms. So the children will also know, and the parents will know what it is that affects each individual child. We don't have to take off all the foods, but you have to see for that child, if he's having, high sugary drinks can be something that can make them very hyperactive. But again, some children can tolerate it, some don't. So it is pretty individualized.
Absolutely. But just you tempted me to ask you one more question regarding the statistic between the genetic preponderance between the parents and the
Environment.
children and siblings.
Yeah. So there is a, it's multifactorial, but there is definite familial links. So there is genetics, there is epigenetics. We don't know exactly the genetics yet, but somewhere 10, 20 years down the track, we'll definitely be able to identify. Functional MRIs are now showing some of the areas where ADHD, autism, all of them sort of sit in that same space. Yeah, somebody shared something. Guru, that what have you put? Connors 4.
That's
Yeah.
four.
Corners four. Corner
That's
four.
Yeah.
nice.
Yeah. So Connors 4 is Pearson. So we send this link. Uh, we send Connors 4 to the parents and the school. And so we get it back on Pearson website, and we get the report. It's expensive. So I don't know whether it's worth it. And I don't know how much it costs you all.
I think it's quite costly for routine use in India.
I think so. So it's simpler to use Vanderbilt, which is available online. Uh, yeah, I don't think Connors 4 is worth doing, Gurudat, in India. If you really want to have a scale, Vanderbilt scale is available. Google it. and you can get it. I think Upasna can talk about it and how to interpret it next time. I can tell her that would be a good thing.
I
Naga,
think
one thing which we have noticed, like, when we have asthma and we ask them to keep a trigger diary, and that
Yeah.
moves. Similarly, in ADHD patient, I found it useful when I tell their parents that which is the time when the child gets hyperactive or has a meltdown, or what triggers and what helps. Because very often parents focus on what helps rather than what supports. And if they can keep
Yes.
a diary that what was the trigger and what helped, it helps them
Yes.
to understand how to monitor the child for coming months.
Absolutely. And that's the thing, from my perspective, there's a very nice parent handout. I should have kept it ready, but I send it to you, Dr. Samir Shah? It's a UK thing. I'll just see whether I have it here.
We can
If
put
I
it in
have it
our
here.
Aacci official website, which most people who are Aacci members will see it, and they
Yeah,
can share it also.
I just see. Yeah, it's not ours, but it is a good one. Uh, if I can find it, I'll send it across to y'all. I share that as a parent information, as strategies. Uh,
Like any neurodevelopmental disorder which we all have seen, the parental understanding and the parental cooperation is the key to the management. Generally, most parents just blame the child and they want everything focused on the child, but they don't realize how much the parental behavior modification and the parental
yeah,
understanding of the problem is going to be a much better combination effort than focusing on the child alone.
I don't know if I can. I don't know how I can share my screen again, but this is understanding and supporting my
Send it on
education.
WhatsApp, Anaga, to me.
I will see. Okay, it's basically information resource booklet. It's ADHD Foundation. It's a 2022. It's a really good parent resource for. Can I send to mail recipient? Yeah, I'll do that. And you, if you can share it with everybody,
Yeah.
that would be great. Yeah. Okay. Any other questions?
Madam, one more question regarding the differentiation between the ADHD and autism. That's always the dilemma will be coming to how we.
Yeah. So autism is a completely different neurodevelopmental problem, but autism and ADHD quite often go together. So
Together.
autism, ADHD, and anxiety, you know. So it's like what I said. It's very difficult to differentiate autism from ADHD because they can have both, but they can have both. So if a child has both and anxiety, then I would need to treat the ADHD before I assess autism, because they won't formally do an autism assessment until they can sit still. Correct. It depends on if they have anxiety, autism, and ADHD. Then anxiety may be so predominant that you can't really do anything with the child, so you might have to manage that first. So it just depends at what age you can have those permutation combinations. It is not either or. Is it how much of it is autism, how much of it? So it is very a layered sort of teasing out or peeling an onion to see what is the child got. So really you start with the symptoms, you start with the history, you look at the onset. Autism will have very restricted sort of behaviors, repetitive behaviors, which is not in ADHD. Yeah. Autism will have the eye contact, which is difficult, the social skills, which are deficit, which is not so in ADHD. So they're quite different, the symptoms, but they can overlap because the child can have both.
One more question is the can severe ADHD student put into a normal school or do they require a special school?
Oh, absolutely normal school. ADHD doesn't need a special school. ADHD just needs teachers and parents to understand. ADHD may need medication to support them, but the medication has to be specific to ADHD. Not, Like you can't treat anxiety and say you're treating ADHD, you know. So uh, and that's really important. So stimulants, non-stimulants, whatever medication you give, they have to, severe ADHD should be, there's no special schools for ADHD. There might be some special schools for autism or intellectual disability, but ADHD is just a normal, unless they've got ADHD and autism or ADHD and severe intellectual disability, then that's a different matter.
So primarily the child goes to a special school for another neurodevelopmental disorder like autism or mental
Yeah,
retardation or low
yeah,
IQ other than
exactly.
ADHD primary.
Yes. So it's an associated problem, but then it's just a pure and simple, straightforward ADHD does not need special school. They just need a special understanding of their difficulties.
And now somebody wanted to know about education concession certificates. We can talk
Yeah.
about India, but can you just give us a little idea of Hobart and Australia? What are the certifications of ADHD in Australia?
We don't have, Australia has what is called as the National Disability Insurance Scheme,
Hmm.
but ADHD is not part of that. So children with autism or severe learning disability and all, we would apply for what is called an NDIS, and then NDIS, the government gives money to use for therapeutic interventions for that child, and that is at the parents' discretion what they use. But ADHD, there is no certification, there is nothing. Parents may sometimes get what we call as a carer's allowance. They may get some money fortnightly because they might not, the child is sent home often and the mother can't attend the job or something. They get a little bit of money as a support, but there's no certification. We do have, in the sense that we have to give the diagnosis of ADHD to schools, because the schools get additional supports from the government to manage these children by having some teacher assistance, etc. So the certification is mainly for the schools to get the supports. What is it like in India?
Samir, would you like to answer or you want me to answer?
Madam, you can continue.
Ah. So what happens is many times as parents come for the ADHD certification, we get a clinical psychologist certificate because they are giving the report which is legally valid, and we send this to the school so that they get some more understanding from the
Yeah,
teacher for
yeah,
supportion. But I
yeah,
think learning difficulty, we can have a certificate, but then they have to go to like in Pune to the government Sassoon hospital. They will not
yeah,
accept a private person's
yeah, yeah,
psychological assessment. And once they get the learning difficulty or any of these problems from Sassoon Hospital, then they have to submit it to the school. And then the
yeah,
school, depending on how severe the situation is, may provide extra time for the writing of the papers or may
yeah,
provide a writer, depending on what is the actual mechanism, whether it is learning disability alone or it has comorbidities like other low borderline IQ or
yeah,
ADHD or multiple comorbidities. Anybody would
yeah.
like to add? Jayashree
Mumbai, I think it is Nair Hospital and Sion.
Yeah. Anybody in the audience who have managed to give these certificates or have dealt with school authorities are welcome to share their experiences.
Mainly, madam, like, there is a two things. One is the government grants, and second one will be the extra support to the related with their academic career. These two things, but for that purpose, the major certificates are issued. But it will be again, if it will be more than 50% problem, then the all these things will be able to give in this type of the problem, not like the other disability. That's a very tricky thing to give that type of certificate in such children, and whether in at which age they are improve, we are not knowing. So again, they have to renew that on different age group.
Actually, AD
Thank you.
certificates are more for understanding that the child will get from the teachers.
Right.
Otherwise,
Yes,
teachers normally blame them as a bad behavior,
exactly. Naughty kids.
argumentative, naughty child. So once
Yeah.
they get an ADHD certificate, there's a little more understanding from the teachers rather than getting any educational concessions.
I think it might. So what we've started doing here is we're doing this, this sort of a talk to teachers and to parents as groups, and really talking about the executive function and how to manage the strategies, just to shift them from this thinking of bad boy, bad this thing. It is just putting it into the perspective of this child has got a neurodevelopmental problem. There's a maturity problem. It will come in time. This is what happens. How can we help? you know it's been a very good response. I made these slides up differently because though but similar sort of pattern, and I think that's something y'all can look at doing through Aacci, because you'll do a lot of school functions, so some local case scenarios, just talking to them about executive function would be something, uh, just to help them with strategies, is something to think about.
Naga, these two slides which you have done, that is the strength-based approach of superpower and the
Yeah,
hand brain model. I think
yeah.
these two will be very good whenever we are doing any parental sessions, right, Samir? We can use
Absolutely.
it properly, yeah.
Yeah.
I think
Yes.
really, because you want to shift that thinking, you
Yeah.
want to make it strengths based and strategies based, and
No,
that was what I wanted to actually share today, that you have to understand ADHD and not blame the child.
Anaga, Aki keeps doing standard modules which we share with our volunteers. Can you
Mm.
please work with us for understanding ADHD, a parental module, so that we
Yeah.
can make one standard one which can be used in all our centers?
Absolutely. And I'm very, and all of these, yeah, I think explaining to them and having a case and having those role, the role plays that we've done for other things may be a really good idea, because that what we are doing is I'm doing only one video, uh, about what it feels like for a child. I'm showing the hand module, and then I'm showing the circle which I've drawn for the control, and then just asking the parents what do their children have and what strategies would use, rather than a lecture. And that's something we can look at how you'd like to do it. You all can do it yourselves, and I'm happy to
No,
help.
we'll three work together, Samir, you and me, and we'll create that module. Samir,
Yeah,
whenever you are a little free, say after January or something.
yeah, yeah.
Perfect.
Next year. Yeah.
We all
Nothing.
have our calendar full till December, right?
Yes, but I think go through what Dr. Upasna also is going to say, and then I'm happy to work on that with you all.
And Gurudat, would you like to join us? You're welcome to make this module. Is he there or he got locked out? He was
Uh,
getting
he,
locked out in between.
he is there. He is there. Uh, But madam, what I suggest in next episode of the our this ADHD part to what Dr. Upasna is going to cover, you must remain present because many questions are correlated within these two sessions, and definitely we have a good interaction next because we are just keeping the our hand close because the management part is not going to cover today. So many questions are flooded with the some
I
management part,
know.
but we are not
I
touching
just
that.
thought that I just thought separating it out and understanding executive function as it's a really important part of management, which we never have time to talk about when we only talk about medication.
Absolutely,
Somebody is
absolutely.
trying to say, Anaga, that we would like your presence there and your expertise at the
I'm going to
question
be in
answer session.
Canada.
Oh,
I'm going to be in Canada in
time
November.
zone will be different. Okay.
Mhm.
Yeah, I don't know. Yeah.
Anyway, in case it
But
suits
what,
you,
yeah,
we'll come, it
because
will be nice.
which day is it going to be?
November, kaun sa hai, Samir?
Just a
Have
minute.
you finalized with? I'm just seeing the
Yeah,
calendar.
yeah, we are already finalized that also.
That is 9 or 16, second Saturday?
Second, I think 9.
9. So November 9, Anaga, you can let us know.
November 9th,
The
I'm
Saturday.
traveling I'll be in the plane.
Oh,
Okay.
I'm traveling, but Upasana is great. I'll have a chat. She's
Sure.
very, very good. I've
Okay.
worked with her for many years, and she's got a lot of patients with ADHD. She's working
Okay.
in Brisbane, and she's very. I've shared these slides with her as well,
Okay.
and I'm sure you all will have a good interactive session, and we
So,
can have a follow up. At any time.
right.
I will send you.
ADHD is such a important, we can have any number of sessions because everybody really needs to know more and more about it. And both parental management and the child's management, the more we learn, the better we can manage our patients.
I think really the most important part of it is parent coaching or ADHD coaching and understanding, and then that's it. They don't need therapies like CBT and all of that. It's
Yeah,
it's not really. They just need psychoeducation and strategies and appropriate medications, and they need the other things ruled out like sleep, hearing, vision, uh, problems, intellectual disability, and autism. Identifying what we talked about, the other things
correct.
need to be ruled out to have a formulation of the whole child, and then unpack what needs to happen.
Yeah.
Thank you very much. I think it's been, have we gone over time?
No,
Just dot time. We had just started at the 3:40 and completed at the 4:40. Exact 1 hour we had completed.
perfect.
So now it's a time to conclude the session with a few key messages. What I pursue that the ADHD is a common and can be diagnosed and treated very effectively if timely diagnosed. Parental understanding and educational support are the crucial part of the managing the ADHD, and long-term follow-up and its outcome study are really needed to improve the treatment approach till now what we are doing over and above. And this is a part one as per the our Aacci International Forum webinar ADHD series by Dr. Anga Jaikar. And definitely, as we just discussed now, 9th November, we are having a part two about the management of the ADHD, along with the more and more question answers related with the same topic. So you all are invited on the 9th June. Please keep the calendar ready with the 3:30 p.m. of the Saturday of 9th November. Uh, just on behalf of the Aacci, I really sincerely thank the Dr. Anka Jaikar and all the participants for their active interaction on the chat at least, and we can having a good question answer session also. And as you know, this 7 to 13 of the October, we are celebrating as an International Adolescent Health Week. And it's a topic, the theme is the thriving, not just surviving, and building the resilience. It's really true for our ADHD children also, because they have to really coming out of their own out box, and they have to survive and giving a good outcome to the society with their excellent efforts and their excellent creativity. What the madam has said, they are really excellent in their athletic part and the creative part. So it's a really a good topic also we had selected in this International Adolescent Week also. Thank you, ma'am, for once again on behalf of us.
Thank you, everybody. I really appreciate you all coming on Dasra Day, because I, in fact, said, should we can change it because everybody will be busy celebrating. Anyway, wish you all a happy Dasra and a happy Diwali in advance. Thank you. Bye.
Thank you. Thank you.
Thank you, Anaga. Thank you, everybody. Samir, you can wind
Yeah.
up.
Yes, ma'am. Thank you.